Good morning. This is my second video. The first one I did, I had some technical difficulties. I'm not sure why. But anyway, hopefully this one will work. And I want to say good morning to everybody. Hello. I don't know what you're up to right now, but I am excited about what I am getting ready to share with you today. So for those who are listening to me for the very first time, my name is Sharon Fant. I am a registered nurse. And I've been a nurse for over 36 years. I worked in the medical field for over 38 years. And I've helped people in all different areas with all different types of diseases. However, I am currently a coach for people who have diabetes. And I am really excited about what I'm going to share today because a lot of people. Hi, Vin, how are you? A lot of people walk around and don't even know that they have diabetes. And a lot of people walk around thinking that diabetes could never happen to them. So today I thought I would talk to people who don't have diabetes, or either they think they don't have diabetes. And this is not this is not a video to bring about negativity. It is a video to help people recognize that they possibly could be at risk for diabetes. So today I want to talk to people who are not a diabetic. Okay, and the reason I say that is because I walked around not knowing that I had diabetes. I went to the emergency room thinking that I had a problem with one thing and ended up discovering that I had diabetes. Okay, I went to the emergency room for a totally different reason. And they said, oh, we have to get your diabetes under control. And I said, I don't have diabetes. And then the lady said, oh, yeah, you have diabetes. I'm like, no, I don't. And they said they had to get my blood sugars under control because they were too high. So this is a service to anybody who is walking around and don't even know that you could possibly have diabetes. So I'm going to talk about 8 risk factors today for diabetes. And you could have some of these risk factors. And if you do, I want to recommend that you go to the doctor to get tested. There is tests that the doctor can perform to find out if you have diabetes. Okay, so and I would say it's a good thing to have it, especially if you have insurance and you know that's going to be covered in your annual, your physical, or or your regular checkup or something like that. Go ahead and get that done. So the 8 factors, and I got them written down because I want to make sure I don't miss any. But I want to just go over those briefly. I won't be on here long. And so the 8 factors that I want to talk about is number 1, if you are 45 or older, 45 years old or older, you should get tested for diabetes. Okay, so that's the first risk factor. If you're over 45, you should be checked. All right, number 2, if you have a parent or a sibling, your sister and brother, with diabetes, you should go and be checked. Okay? You should be checked. If your parents have diabetes or one of your sisters and brothers have diabetes, then go to get checked. Okay? Or have your doctor check you. Number 3, if you are African American, American Indian, Asian, Hispanic, or Pacific Islander descent, then you should get tested because the incidence of having diabetes with those categories are high. Okay, so that's number 3. Number 4, if you lead a sedentary lifestyle with little to no exercise, you should be tested for diabetes. Okay. Number 5, if you have high blood pressure, you should be tested for diabetes. If you've been told you have high blood pressure, you're taking medication for high blood pressure, you should be tested. Okay? To see if you have diabetes and or pre-diabetes. So one of those 2 things may show up. You may not have the full-blown diagnosis of diabetes, but you could be pre-diabetic. And with that knowledge, then you definitely want to start altering your lifestyle, Okay? Number 6. If you have an abnormal cholesterol level, and if you already know that you have high cholesterol and you're taking medication for high cholesterol, you should be tested for diabetes. Now, if you have a low HDL or a high triglyceride, then you should be tested for diabetes, okay? And or pre-diabetes. Now, number 7, if you have a history of cardiovascular disease, you should be tested. Any kind of cardiovascular disease, including what I just mentioned, which is high blood pressure. But any heart issue that you have, you should be tested to see if you have diabetes and or pre-diabetes, okay? And then number 8 that I'm talking about, of course, there are other risk factors, but these are the top 8 that I wanted to make sure I mentioned. So number 8, and this is pretty much for women only. If you have polycystic ovary syndrome or PCOS, your doctor has told you that you have that, you should be tested for diabetes. Okay, so there you go. These are 8 risk factors that are commonly seen in people who have diabetes, who have been told that they either have diabetes or they're told that they have pre-diabetes. Now, so if you have not been tested in 2018 for diabetes and you have some of these risk factors, I do want to recommend that you make an appointment to see your doctor in 2019. If you can't get there before the end of the year, start in 2019 going to the doctor and checking to see, hey, and you don't have to say I want XYZ test. You can just say, hey, can you test me for diabetes? And he'll know exactly what it is that you're talking about, okay? And he'll know what test to order for you. I would recommend that you are fasting when you go to the doctor. Try to get an early morning appointment because it is best if he tests you while you're fasting. Okay, so he wants to see what your blood levels are before you eat any food. So fast for minimum 6 hours before you go for that doctor's appointment. So set up an appointment with your doctor knowing that that is one of the tests that you want to get. And when you go, be fasting, and he can pretty much just send you right from the office over to the lab. Okay, so that is it for today. I'm excited to share this information with you because I know that this is going to help somebody. All right, so now if you're looking at this video now, I want to ask you to do me a favor and share it on your timeline. Hit the share button because there may be somebody on your timeline that may want to know about the information that I talked about today regarding risk factors. So, and also if you are, listening to me today, hit the like button and make a comment. So thank you very much for watching, and we'll see you tomorrow. Take care.